To have this program included in your learning record, you must watch it to the end.
Hello, my name's Mike Butler. My Indigenous blood comes from Jagalingou country in central Queensland, but I live here in Sydney on the traditional lands of the Eora people. Aboriginal and Torres Strait Islander people have lived across this country for more than 60,000 years. Our complex and diverse ways of life are the oldest continuous cultures in human history. Indigenous people live all over this country, in the outback, rural areas, regional towns, on tiny islands, or, like me, in the big cities. But we all have three things in common: connection to culture, connection to community, and connection to the land.
Country for Aboriginal people is very important. It's where we're from. The earth is our mother, so we always say that we're from the earth. And when we go back to country, even though we may live off of it, we always yearn to go back to it. And when we go back, that's where we feel complete.
Well, I think it's a different mindset to non-Aboriginal people, because Aboriginal people believe, well, the land owns them, not the other way around. They don't own the land. Like, the land is there for everybody.
That connection to the land is what drives Indigenous family and kinship structures. Kinship is about meeting the obligations of your clan. It's a system that governs social interactions between people. It determines their rights, responsibilities and behaviour.
So all this is connected to how we lived, where we lived. The ceremonies are there, the marriages, how he was connected to the land, connected to that animal, that bird. So all them stories, all that knowledge is still there.
Family for Aboriginal people is defined a little bit differently, I think. It's a bit more than mother, father, brother, sister. For us, the family extends to aunties, uncles. Aunties and uncles can be also mother and father. It goes to cousins as brothers and sisters. So I once went to a reunion where 300 of my immediate family members were there, and it's sort of like overwhelming sometimes to meet that many of your family all at once.
Before European settlement, there were more than 500 Indigenous nations across this country. Hundreds of languages and dialects were used to pass on our history and our culture between generations. In 1788, 11 British ships sailed through the Sydney Heads behind me. The arrival of the first fleet. European settlement would forever change the lives of Australia's Aboriginal and Torres Strait Islander people.
When they lost their children, they lost everything. And I don't know how the missionaries realise that. They break family up like that pretty easy.
Millie is part of the stolen generations. At 2 years of age, she was sent to live on a mission, taken from her parents.
took us little ones away, and then just left mum and dad to look after nothing. And they were sort of crying inside. They couldn't do anything about it, because if you did anything about it, the welfare would be called on you. Authorities,
because I wasn't brought up with my country or my family. I was separated from my family, and it was very difficult for me to interact with my family when I got older.
It breaks their hearts, and they don't want to go. Especially, you're brought up there all your life nearly, and then all of a sudden something says you've got to go. You don't live here no more. And your heart just tears. It's like somebody's pulling you one way and something pulling you the other way.
It was official government policy to assimilate mixed-race Aboriginal children by putting them in white institutions or foster homes, away from their families, language and culture. Aboriginal and Torres Strait Islander people weren't officially recognised as Australian citizens until 1967.
The whole thing of the mission was to get rid of your culture, to teach you a new way, to teach you how the English way, to teach you the language, to teach you the stories about everything that you didn't connect to.
I couldn't connect with my family because I didn't know how to do it. So I wrote a poem. We are the stolen children who were taken away, torn from our mother's breast. What can a child do? Where can a child turn? Where is the guiding hand a child is meant to have? Where is the guiding hand a child is meant to have?
Aboriginal health's been impacted by past government policies and since colonisation of this country, where our diets were changed radically in a short time. We weren't able to hunt on land and enjoy the traditional diets that we had. And so now we have high rates of diabetes, heart disease, lung disease. Smoking is rampant in our communities. It's one of the highest rates of smoking in the country. We have infant mortality that's equal to undeveloped countries. It's a bad outcome for us in those ways.
Aboriginal and Torres Strait Islander people can show common signs of age-related chronic diseases from as young as their mid-40s. Their life expectancy is around 10 years younger than non-Indigenous Australians. As a result, Indigenous people can access aged care services from the age of 50. That's 15 years earlier than non-Indigenous people. The Pilbara is a remote area in the northwest of Australia.
There would be. Just have a look. Come on, Green.
Aboriginal liaison officer Jean Norman and her granddaughter Karina are looking for snakewood and river sand. They'll use what they collect to cook kangaroo tail for the residents and clients of Yandina Community Services.
Yandina has been in operation since 1975. It's the largest local non-for-profit organisation in the Pilbara. Back in those days, started up by volunteers and the local nuns, and has since remained here ever since, providing those services.
Yandina's aged care services include a home and community care operation, as well as a residential care home.
Not many people can work in the environment that we work in. I mean, we work in it's the Pilbara, it's middle of nowhere, and it's stinking hot. I mean, we work with predominantly Aboriginal people, and a lot of the people that we look after here are diabetics. I'm just going to do your sugars, okay? And then I'm going to hook you up to my machine here, okay? It's challenging from a mental point of view because you know these things are preventable and you do your best to prevent them, but it still doesn't always seem like enough. And then the conditions themselves, I mean, you have to prick their fingers and take blood on a week-by-week basis. Some people, we have to control how much fluid they intake, and in a hot environment like this, you feel cruel. But what's more cruel is letting them die in a year or two because their kidneys give out.
Working in a remote place presents challenges that staff may not see in regional or metropolitan areas. it can be difficult to get in touch with residents' family members and explain medical conditions.
For example, I have residents who are dysphagic. They don't quite understand why they need to be fed with pureed diet or thickened fluids instead of normal diet. I guess back in the community, they don't do it like that, and they eat like what they normally eat, like kangaroo or bush ducker, what they call it.
Dementia has become a concern for Aboriginal people in recent times. The Kimberley study showed that dementia is 3 to 5 times more prevalent in Aboriginal people than in mainstream Australia. With our ageing population will come more instances of dementia. Dementia itself will lead to our older people losing stories, losing connection, not being able to pass those stories on. So it will have a huge impact on our communities.
Obesity, poor nutrition, violence and substance abuse all contribute to the health status of Indigenous people. A number of government strategies aim to improve health standards. The National Aboriginal and Torres Strait Islander Health Plan is a policy framework to provide culturally safe, high-quality, responsive and accessible healthcare. Closing the Gap aims to achieve equality in life expectancy and the overall health status of Indigenous people by the year 2031. Back in Western Australia, Jean Norman has returned from the bush, bringing the snakewood back to the care home.
Jean is our Aboriginal liaison officer, so she'll come in and she'll sit and talk with the residents. Right now she's painting nails, she'll do activities, she'll take them for a walk around the facilities. She's basically our go-to person.
If we cannot understand or translate Aboriginal words, she's the one who translates them for us.
Cultural activities at Yandina include regular excursions. Some of the residents visit a jail where Aboriginal people were once locked up for refusing to work as slave labourers.
You can't work in this industry in this particular area without understanding it, because, I mean, there's been mountains of mistrust between the Aboriginal people and those of European descent. You really need to have that level of respect for the culture to be able to work with these people, because if you don't, 1, the culture is lost, and 2, you're not showing the respect that they deserve.
Basically have a conversation. Conversation is the biggest thing. Sit there, talk to them. You can learn a lot of these people. Just engaging. Take your time, patience, eye contact. Some people don't like it, but if you sit there and look at them, even during lunchtime, just sit while they're eating, they'll talk to you, and they'll eventually get to trust you.
Because here I am.
Hi Lise, what you up to?
We're just creating the new observation sheet for the RN.
I sit and listen to them, and you know, and like we'll be sitting down there, and a lizard will go past, and I'll point it out. Oh, there's a lizard. What's the name of that lizard? And they'll come out and tell me, and just doing simple little things like that, and it's just you gain their trust and respect.
Coming behind me. Down the beach.
So I'm what's known as Mithy, which is white nurse, literally. They refer, the Indigenous Australians of this part of Australia refer to me as Mithy, and they respect me as white nurse, Mithy. And you need to respectfully talk to people, which involves calling them by their correct titles.
Quick prick, uncle.
Juju is male Aboriginal elder, Judda is female elder. Others you can refer to them as auntie and uncle. 10.5 uncle, but it's a bit high. You always need to ask before you do that.
At Yandina's Home and Community Care Service, it's another busy day for manager Deb Ryan.
It's, just very different. Like when you first go out and assess the people, meet the people, you're actually never invited into their homes. It's very, very private to them. So even in 45-degree heat, we sit out the front and we chat to them, find out what sort of things they want, what their needs are. I guess, and a lot of advocacy, because most of these are elders. actually have no birth dates. Some of these guys were born under trees and things like that out in the bush, so we go and pick them up from their homes. We bring them back, take them shopping, take them to doctors, and then we'll go and deliver Meals on Wheels.
I come here to have breakfast and lunch and pay for my meals and out of my pension and have a shower, change the clothes, yeah.
Yandina's home and community care service is expanding to a new building, with a new community garden for visitors and aged care residents.
So these vertical screens, we've decided to go with the what Deb liked was the more natural spin effects looking.
I know they're different, but sort of came about from looking at some of the local Indigenous people in the residential aged care, sort of looking out of the window or looking out of the fence lines, and their connection to country. And the gardens have been built with meeting places in mind, with a fire pit, and those things that are culturally accepted by Aboriginal people. And this gives them an opportunity to get out into gardens and feel a part of being back out on country, I suppose.
There are a number of government programs to assist aged care providers with issues like dementia support, culturally appropriate care, and the training of Aboriginal and Torres Strait Islander staff.
Our Indigenous carers that we have here are very, very good. They're very passionate about what they do, and I think that's reciprocated from a client perspective. They can talk to and relate to people who understand them. I think from a point of view of residential aged care, I mean, government funding's very important. We don't have the luxury of being able to access bonds like they would in normal mainstream aged care societies, because quite simply a lot of the Indigenous people up here don't have the money.
I'm taking 2 out here.
The residents at Yandina often have kangaroo tail in their stews, but this is a more authentic way of cooking bush tucker. Once the fur on the tail burns, Jean scrapes it off. The tails are wrapped, then buried in river sand inside the barbecue.
Some people, they don't like to visit here because it feels like a closed institution for it's like a big white fella institution, and it feels like it's locked and it's not open to them. They have to ask permission to come here, but we don't do that way. We encourage them to come and visit their family members.
I love it. Yeah, because they're good people. The people are nice, and they got friends. I don't know. You go a lot of places and you don't feel welcome. This place, I feel welcome anytime.
And occasionally getting a kiss on the cheek and say thank you. That's what I hear every now and then, and it makes my day. And even when you get it from the family as well, and when you hear thank you for being there for them, that's gratitude enough.
Jean's kangaroo tail is almost ready to eat.
My husband used to do. Used to get off with the gun, go down the riverside or hill and get a kangaroo. Yeah. But now you don't see much kangaroo now. Very hard to find. Bush tucker is stronger. But it will keep you strong and healthy.
At Elders Village in South Australia, Aboriginal elder Major Sumner is preparing a smoking ceremony.
Different Indigenous people, they do it for different reasons. They do it differently. The bowl that I used was made by a nephew of mine. He cuts them off the gum tree. The big knots that's on the gum tree, he cuts them off, he hollows them out.
The Aboriginal Elders Village is operated by Aboriginal Community Care SA, and it's a residential facility for Indigenous people, giving them an environment that's safe, that promotes independence as much as possible, that connects them to the health services that they need, connects them to the cultural activities that they enjoy, and a sense of family as well.
Our message is to treat everyone as an individual and with respect, and talk to them about their preferences in terms of their cultural care.
Uncle Moogie's smoking ceremony is part of that cultural care.
We have residents who reside from all different areas of Australia. Each of those communities have got different spiritual and cultural beliefs. So, example, during sorry time, those residents, female residents from the APY lands, they would cut their hair and burn their hair during sorry time. Others may wail. Different communities have got different ways of expressing their sorry time. And as staff, we need to be aware of these differences.
Good morning, Ruth. We've got doggy here. Mix, come on.
When a new staff member arrives, normally they're teamed up with a more experienced staff member to assist them in their role here because of the cultural differences. And this assists them with being aware of the different needs of each particular community. For example, we have some male residents who do not like to be assisted by a female staff member. So we always try to engage a male staff member to take care of their needs.
Did you come out to see the fire pit or did you come out to see me?
The health considerations, comorbidities and general health status that elders come into the village with can be quite a challenge. Some of the elders that we have come from very remote areas such as APY lands. They need to be in a metropolitan area for health services. So it can be a struggle for them to adjust to living in a metropolitan environment.
It was very hard for me to move, but I knew I had to. So I packed my gear up and came here, and I was accepted straight away. So obviously the matron liked me.
A fire pit helps the residents feel more connected with their culture.
Because our age group is of resident is just 50 and above, there are some residents who are still independent and managing their own affairs. So that means they can go out on their own, so they are free to go out. So sometimes when they go out, we can't monitor what they're doing in terms of their diet, and sometimes they miss their medication. So I think health-wise it is a challenge to monitor it and maintain their health.
And I've just got a new baby.
Oh really? How old?
10 days old.
Oh, have you seen her? Everywhere people want respect, but respect is more important for Aboriginal people. So they give respect and they want to be respected. Plus, Aboriginal people like their crafts, arts and paintings. Like almost everyone loves painting in here.
It's relaxing. You go in a world of your own. And you're focusing on what you're doing. And that white one, that's the Milky Way. But later on, I will change it.
But we believe that the aged care sector plays a big part in closing the gap objectives. Our staff are with elders on a regular basis. We're able to monitor the well-being of those elders. If we see that an elder is going through a particular period where they may need additional support, we're there to be able to either provide that support or refer them to the appropriate service to get that support.
I enjoy sitting around the fire with the elders. It seems to relax them, but it's a very social time for them, and it's when they seem to open up and I hear all about their cultural experiences and all their life stories.
I think it's very important. And they understand my culture and I understand theirs. It works both ways, to understand each other's cultures.
Our ceremony we done this morning was to help the spirits of the people that passed away, help their spirits to go home. They're here, they could stay here for a while. So what we do is we ask our ancestors, and bringing in the ancestors from the 4 directions, we ask them to come here and to help that person's spirit to go on with them. Take them home to where they come from.
That means that room can then be utilised for the care of another elder at a later stage. Culturally appropriate care at end stage of life is very, very important, and it's something that we have to give due consideration to all of the time.
We are very confident that our services not only provide aged care supports but also improve the quality of life of elders as they age. Choice and control and consumer-directed care are equivalent to self-determination, and that is a big part of what our organisation is achieving. We utilise the National Job Creation Package, NJCP, on our services on the API lands. We are able to employ local Aboriginal people using those funds, which we top up through our mainstream CHSP funding. So that leads to good employment outcomes for Aboriginal people on the API lands, but it also leads to good services and services by local Aboriginal people.
So the most rewarding part of my job would be seeing the residents' faces when you arrive in the morning, the smile, the thank you, the hug that you get, and also knowing that you're helping them to live a life of quality, self-esteem, and just be part of their family as well.
The truth is, Indigenous people in aged care today weren't even considered part of the population when they were born. We can't change that, but we can give them the care and the respect that they deserve today.
It's a great time to be Aboriginal in this country at the moment because, you know, the Europeans are accepting that they did some bad things back in the day. They are trying to say sorry, and we understand that it was hard for them to say that, and we're all moving forward in harmony together. The spirit of reconciliation is an awesome thing, and I think it's growing bigger and better.
Living as an Aboriginal person in Australia today, I think we've learned to cope quite well with that, to be able to keep strong in our culture, but also live in basically a Western world. So, you know, I drive cars, watch TV, but I also practice my culture, ceremony, language. It's a balancing act. Some people describe it as walking a line between two worlds all the time. And I like to say it's not really walking a line, it's basically having a foot in both sides at all times. You must be able to relate to both cultures constantly.
Whether we like it or not, we have to live in two worlds, we have to learn how to survive in this world. But we bring our world into it. We don't leave our world back there. We bring it here till today.